It's a pleasure to have with us Dr. Arash Rashidian, who is the Director of Information, Evidence and Research in the Eastern Mediterranean Regional Office. Dr. Rashidian, we're talking about universal health coverage. How do you think the countries in the region fare with relation to the evidence they have in order to be able to reach?
Okay, I mean, first of all, it's a pleasure to see you again.
Thank you.
Last time it was in Islamabad.
Yes,
we had a chat like this. And so, I mean, this is a very important question. So when we talk of universal health coverage, the issue is about how the health systems as a whole, or the healthcare structure, responds to the expectation of people so that everybody who needs care can receive it. So universality, that's the concept of it. But then if I'm a minister of health, for me it's important really, do everybody really get what they need? What do they need? What are their needs? And then how do I measure it?
Yes.
Because when we talk of universal health coverage, we are talking of a series of interventions at different levels. Not everybody needs the same thing. The processes are different. So that measurement concept becomes a bit difficult.
Dr. Morocco gave us an example of where they listened to the public. They had a survey apparently to find out the needs.
Sure.
Is that a tool used?
I mean, we use data sources from household surveys, that's what we call them. We can also use this data sources from facility surveys. I mean, when you assess, and it could be about patients themselves, or it could be about service providers. But the main issue is that not a single indicator on its own
is sufficient.
Yeah, absolutely. So then the issue becomes to how to develop an index. And then how to select the indicators that are best representing the provision of healthcare to reflect the universal health coverage. Again, additional problem is that it's not just about what indicator is the ideal indicator, it's also the indicator should be cheap to measure, should be available, because you do not want to invest too much energy and too much time on measurement. Absolutely. Your main thing is to doing something for people and using the measurement only to guide you. Not the measurement becomes your aim, which is the wrong approach.
Thank you so much. This is so reassuring to hear from the director himself.
Absolutely. And then the issue becomes, when we usually as WHO, we are focused on national level data. But for countries themselves, it matters to know the details. So what's happened about different geography, different
which governorate
population, which governorate, which rural urban areas, rural urban areas within the governorates, within the provinces, and different age groups, different approaches. So with every question like this that I put here in a few seconds, I'm actually opening up a major
Pandora's box, actually.
Absolutely. So to do that is really important. So it's really, what you have in mind, something really big and important, and you need to measure it comprehensively. But then you need to economize on that as much as possible. And that has been the focus of work that has been happening in the WHO in the last few years.
Have you developed some tools to make things easier?
Yeah, WHO has developed a sort of an easy-to-measure tool that was published in 2017, and we've done some modeling based on that for this region. There is now additional work happening on that, how to sort of expand it further and how to keep it, more in tune with the expectations of the society. My worry in this region is about how much data we have, original data from the region to reflect the situation. Because unfortunately, the status of data, national data, is not very strong. I'm saying that not as a negative thing, but I'm describing the situation. The reality is that within the last 5 years, there has been excellent progress in data issues in the region. Still, we are lagging behind. So a lot should happen to make sure that data issues, especially basic informations, are available. The other issue that becomes important is that when you sort of measure, then how to pinpoint it with the policies. Because as a policymaker, as a political
you have to say a lot of things.
As a political position, I might say I want to have UHC, but UHC is not one thing. I want to have UHC is a motto. But in reality, you do this and you do that, you do this here and you do this in primary care, the doctors should do that, you do this.
It's a long process and it takes a lot of work.
And it's really, for me, is important is that which one of those things are improving my UHC. And using the data to see which one of them I need to do work on that further. So then the issue becomes not only the data itself, is the measurement approach. You may need research assessments to evaluate the effects and bring that together. So you start with the concept of I want to measure UHC and I want to ensure that I'm doing the job properly, But then you end up with the health information system and research evidence approach that requires to support you in your program.
Thank you for enlightening us that reaching universal health coverage is really no easy matter. It requires a lot of steps, a lot of work, and it's not just a political slogan. Thank you, Doctor.
It's a pleasure.
Thank you.